In this video, I'm going to talk to you about a medication called ketamine, which is most often used, or at least initially was used, to help people be put to sleep or to provide pain relief in cases of surgeries or procedures. So this medication is known as an analgesic, which is essentially something that provides pain relief. Also known as an anesthetic, which can help people withstand pain. It is a sedating medication that's usually used or often used in surgeries or procedures by an anesthesiologist. It helps treat pain, but it's been found to also help with acute episodes of depression. So it works on the brain and body by blocking the NMDA receptors. And so there's a chemical neurotransmitter called glutamate, which is the neurotransmitter or the chemical hormone in the body that causes a lot of excitation or active component to it. And so ketamine blocks this activation of glutamate and NMDA receptor. As mentioned, it's often used in surgeries, but we find that in psychiatric purposes, it can be used in people who have acute depression or depression that's not fully controlled with the current treatment. So typically ketamine can be indicated for people who are already taking antidepressants but don't have full relief of their depression. The ketamine that I'm most familiar with in the clinic setting is a nasal spray, but there could also be an injection form or an intravenous form. One of the cautions about this medication is it can cause people to dissociate, like they get an out-of-body experience, or they may get experiences like they're in another world or something that dissociates them from reality in that moment. This medication can also cause significant changes in blood pressure. It could cause it to get really high or really low. And then that can cause lightheadedness, cause dizziness, could increase chance of falls. So this ketamine may be helpful in the emergency room or in the urgent care settings with patients that are actively suicidal or really depressed. But typically it can take several doses over the course of days to weeks for someone to get relief of their depression. Due to the changes in blood pressure and the mental state that can happen as a side effect of this medication, oftentimes it needs to be monitored after someone takes it. So usually by a nurse or some staff member should monitor the patient after they take ketamine. That's one of the reasons I'm not able to prescribe this in my office setting, just because I don't have typically the staff or resources available to give the patients that monitoring that they may need after taking this medication. Other side effects include, but not limited to, nausea, vomiting, confusion, changes in the heart rate, bladder inflammation, weight loss, problem with the eyes or vision, or muscle problems. With that being said, I do have multiple patients that get ketamine from other clinics or from an app-based providers. They do find it's helpful to relieve their depression on top of the antidepressants they're already taking. So it could be an option there to help with acute clinical depression.